Let's take this to a performance aspect. Say you're going to do some kind of activity. We'll use running as an example. You're going to run 10K in the middle of the day, and you're working at home before that in the office, and you can work with electrolytes and hydration to best facilitate your performance on that run. What will you do leading up to it to make sure you're ideally hydrated and getting enough electrolytes?
It's a loaded question. So, number one, depends on what you are doing. If you are just training and you want your performance to improve later on, or if you are in competition and you really want that race to be your fastest, best feeling race, two different strategies. When you are sort of just training, well, there's actually a third strategy. If you're just training and you want a good workout, typically somewhere between 800 to 1,000 milligrams of sodium with 10 to 14 ounces of water, 45 minutes before that activity, just so you feel good, you have a good training session. If you want to have dehydration acclimation, where you are volume depleting yourself, you're becoming mildly dehydrated, and then you're getting the acclimation benefits through that, then you don't really even hydrate prior to, let's say, running. So you're coming off that run, that 6.4 mile run, which is about a 10K, probably 2% dehydrated. You don't want to ever go to above 5%, but somewhere between 2 and 5% is not life threatening. So you'll get all the blood volume expansion benefits. You'll get the increases in red blood cell benefits if you become dehydrated acclimated. And then for a race on competition day, if you're running, let's say we said a 10 kilometer, that's 6.4 miles. Let's say you do 6-minute miles. So that's like 36 minutes of running. I would probably do in that instance, it depends on also how hot it is that day, but I would say at least 2,300 milligrams of sodium. So 1 teaspoon of salt in about 20 ounces of water, starting 90 minutes beforehand, and you slowly consume that over 30 minutes. That gives you 60 minutes for that salt and fluid to absorb and expand blood volume. You can go up to 4,300 milligrams of sodium in a full liter of fluid, and that will really boost blood volume, like 8 to 10%, and that'll prevent the drops in blood volume that happen with, basically vigorous exercise.
Let's come back to the second scenario there, the hormetic benefit.
Yeah.
How often would somebody want to do that as part of their training in a week? And then give me the specifics of when they would introduce hydration again to not push it too far.
They would introduce it after the workout. So you basically, you don't preload with salt and fluids. You allow the body to become 2 to 5% dehydrated, and then you rehydrate back. So in that period, what's going to happen is basically aldosterone levels are going to increase when you become volume and salt depleted. So now you have this elevation in aldosterone, which is a salt retaining hormone. So what ends up happening now is the salt that you consume after that workout, you're going to absorb more of it and hold on to more of it, which will help expand baseline blood volume. So now the next time you run, you're going to perform better because your baseline blood volume has expanded due to the increase in aldosterone, but also there are increases in proteins too that will help you expand blood volume. So they've actually done studies looking at this. About a third of the benefit is from aldosterone, and 2/3 of the benefit is actually due to this improved oncotic pressure due to the basically more things like proteins that are holding on to more water as you become dehydrated, acclimated. So that's essentially how you would do it, is you would just rehydrate afterwards. If you want the benefits, of dehydration acclimation. How many times you would want to do that? The more times you do that, the more you will adapt and become better. So we have good data on this for sauna therapy, where if you do 4 sessions a week of sauna after exercise, like 30 minutes of sauna sessions 4 times a week for 3 weeks, a total of 12 to 13 sessions, you are essentially fully acclimated. So I would also assume that if you did that amount of sessions per week, total of 12 to 13 of dehydration acclimation through this not hydrating beforehand, that would also fully acclimate you.
For somebody, we can use the sauna example or exercise. We're putting the hormetic part aside for now. any difference in rehydration after one of those? Say it's vigorous exercise and we're sweating a lot, losing a lot of electrolytes.
Mm-hmm.
Say over the next rest of that day, in either of those scenarios, how do we replenish ideally?
That's a good question. There are a total of about 10 minerals that are lost through sweat in a fairly significant amount. Obviously, sodium and chloride are the highest of those 10. However, remember how I said that sodium and chloride have really good bioavailability when you ingest them, but almost all other minerals do not. So take chromium, for example. Chromium's bioavailability in the diet is only 1%. So you lose typically, in the studies vary, but if you lose, let's say, 10 micrograms of chromium, you have to consume 1,000 micrograms to get those 10 micrograms back that you've lost. So if you start losing and sweating a lot, you should be replacing chromium. You should be replacing copper, because you do lose a fair amount of copper, and it ranges, but copper's bioavailability is only about 30%. So if you lose 1 microgram of copper, you may need three micrograms to get it back. I should have used milligrams. If you lose 1 milligram of copper, you may need 3 to get it back. So copper is another really important mineral we lose through sweat. So you need to be thinking about copper, zinc, iron, even calcium when it comes to hydration after you sweat, because what you lose, typically you need 3x intake to regain it back for all other minerals besides sodium and chloride.
And when it comes to that example and the loss of these different minerals, is there an easy way to get them in a good ratio afterwards? Because it's becoming quite complex for the average person quite quickly. Is there a certain supplement they can take to get those again in that ratio we want?
I would say so. Most people are going to be getting fairly good amounts of those minerals, except for chromium and copper. So I think supplementing with those two after you sweat, in addition to salt, I think makes a lot of sense. Chromium, copper. So probably somewhere between 100 to 500 micrograms of chromium, and somewhere between like 1 and 3 milligrams of copper would probably be a good idea if you are sweating for an hour a day.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
I had started doing it 6 years ago, and I was scared to share it with my followers because I thought they would just say, oh, you're just saying this to push a supplement. So I never did. I haven't even talked about this until years after I published on this topic. Being on a high animal protein diet can actually